On today's episode of Coding Corner, we are going to discuss OASIS items J0510 through J0530. Pain. Steph, why don't you get us started?
The intent of this question is to assess if pain interferes with the patient's specific activities. These activities being sleep, therapies, and day-to-day activities such as dressing, bathing, transfers, and walking. First, we need to conduct a comprehensive assessment noting the following. Pain is highly subjective and can be difficult to quantify accurately. Patients may interpret pain differently, making it challenging to obtain consistent responses. Older generations may be reluctant to discuss pain openly, internalizing their discomfort instead of verbalizing it. The clinician may have to use words like discomfort, aching, burning, soreness, or tenderness to obtain an accurate response. Patients with cognitive issues may struggle to understand or respond to pain-related questions accurately, so use a measurable tool. The numerical scale is one way to measure a patient's pain by asking them to rate it from 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. The Wong-Baker is a test that uses 6 faces from happy to crying to assess pain in patients with cognitive issues, or the PAINAD scale, in which pain is assessed using 5 categories and is used most often in patients with dementia. To assess pain characteristics, we need to assess the location, the onset, the intensity, and factors that aggravate or relieve pain. To assess the frequency, we need to inquire how often pain interferes with activities using the terms rarely, occasionally, frequently, or almost constantly. Do not elaborate on what each response means. Let the patient determine their own interpretation of each response, and if the patient is unable to decide between 2 options, the assessing clinician should code for the option with the higher frequency. Tina, can you tell us about the time frame for assessing pain and talk about J0510 and J0520?
Yes, of course. Thank you, Steph. The time frame under consideration for assessing pain is the day of assessment, which is day 0, and the 5 days before the assessment in the home. There are 3 pain items that we are going to discuss today. The first one to consider is J0510, sleep. In the past 5 days, how often has pain made it difficult for you to sleep? Another way to assess for pain is to ask the questions in a different way, such as, has pain made it difficult for you to fall asleep at night? Has pain awoken you in the middle of the night? Are you ever awakened by early morning pain? Some other factors you need to consider during your assessment include inquiring about medication use. Ask the patient about the use of pain or sleep medications to manage nighttime pain. Physical signs. Look for signs of fatigue, daytime drowsiness, or falling asleep during the home visit, which may indicate that the patient may not be sleeping well at night. Environmental factors. Assess the sleeping environment for potential contributors to pain or sleep disturbances.
Thanks, Tina. So next, let's talk about how pain may interfere with therapy or how to answer J0520.
J0520 is how often does pain interfere with therapy? The assessment period for J0520 encompasses the previous 5 days, including any time spent in an inpatient facility. This time frame is crucial for accurately evaluating the patient's condition and treatment progress. Inpatient includes rehabilitation therapies such as physical therapy, occupational therapy, speech therapy, cardiac rehab, and pulmonary rehab. Rehabilitation therapies can encompass a range of approaches, including in-person supervised treatments conducted by therapists, nurses, and other qualified staff members. And it also includes self-administered therapy programs that are carried out by the patient or implemented by family members or executed by caregivers, such as a home health aide. In other words, therapy does not have to be formal, inpatient, or in the presence of a therapist or nurse. In-person therapy provides hands-on support and immediate adjustments, but requires time and access to professionals. Self-administered programs offer flexibility and independence but rely on patient motivation and proper execution of prescribed exercises. Both approaches can be effective depending on the patient's needs, abilities, and circumstances. Steph, would you like to tell us about the last pain item, J0530?
Sure, Tina, thanks. One of the things we see here at HealthRev as an outsourcing agency is that this item is often underscored as clinicians are hesitant to choose response 3 frequently or response 4 almost constantly when assessing their patient. I've seen the pain assessment show a numerical response of 4 or 5 in the lower back. However, the OASIS response chosen is rarely for all 3 J items, which doesn't really make sense. What we need to remember is that we are not asking how often the patient has pain. We are asking how often the patient has pain that interferes with day-to-day activities. Those day-to-day activities could be anything from completing their ADLs to taking a walk, preparing a meal, going out to a restaurant with family, or even doing laundry. This takes me back to the importance of conducting the OASIS walk in the home for every patient. The assessing clinician must get the patient up and walking if possible. Of course, if the patient is bedfast or chairfast, you may want to assess pain differently by asking the patient to roll over in bed or bend down to tie their shoes in the wheelchair. Pay attention to their facial expressions, such as facial grimacing and nonverbal cues, to determine if pain is present. If the patient is ambulatory, ask the patient to get up and show you their bathroom. As they transfer and begin walking, assess for nonverbal cues and then ask the patient if they have any pain while they are performing these activities. The clinician may need to use alternate words besides pain to get an accurate response from the patient. Ask if they are uncomfortable. Ask if anything hurts. Is any part of the body burning, tingling, or aching? A patient with osteoarthritis, rheumatoid arthritis, neuropathy, or spinal conditions may have had the condition for a long time. So long, in fact, that they may overlook reporting it as pain, saying, "Oh, I'm used to it," or "I've had it for years," and they may not think to report this as part of the pain assessment. It's important to know the patient's diagnoses beforehand in order to perform the best assessment. That's why it's important to ask the right questions, observe nonverbal cues, and the patient's environment as you are assessing for pain. In conclusion, clinicians must recognize that pain is a complex, subjective experience influenced by biological, physiological, and social factors unique to each individual. To provide optimal care, home health clinicians should conduct thorough assessments using validated tools to gauge both pain intensity and its impact on the patient's daily function. They should develop personalized treatment plans that incorporate pharmacological and non-pharmacological interventions. They should collaborate closely with the patient, their families, and other healthcare professionals to ensure comprehensive care. They should educate the patients and the caregivers about pain management strategies and the importance of adherence to their treatment plans, and they should regularly assess and adjust their treatment approaches as needed, recognizing that pain management is an ongoing process.